Boom 0. r/AskReddit. Doctors of Reddit. How do you know if a patient is faking? My husband is a firefighter and EMT, and he told me about a time where they were called for a man seizing. When they got there, a guy was lying face up on the floor not moving and then started faking a seizure. They stood there saying things like, "Oh wow, this is a bad one. But if they did X then we should really be worried." And the patient would suddenly start doing X behavior. Apparently this went on for a while until he miraculously woke up in the ambulance asking for opiates. Husband is a urologist. ER calls with a patient who is reportedly writhing in pain from kidney stones. Patient brought with him a stone he passed for analysis. Hubby walks in, sees one of the regular drug seekers, takes a look at the sample, determines it's a pebble guy picked up in the parking lot. I'm a detox RN in an alcohol and drug rehab, and I often assess my patient's anxiety level. I say, on a scale of 1 to 10, 10 being a debilitating panic attack, how do you feel? I have an internal rage when they yawn while saying, "Oh man." A 9. Bitch, I've had a panic attack. I can't see straight and I get sweaty and cry uncontrollably. Adventure therapy leader. I had a participant keel over and pretend to pass out. Everyone else shaking her and calling her name over and over, no obvious wounds. She was definitely breathing quietly and had a normal pulse. I lightly pinched her on the cheek, a slight eye twitch from her, and with great gusto I proceeded to give her one hell of a sternum rub. Fold a finger over and rub the first knuckles over someone's sternum. You can't ignore that shit. She came bounding upright screaming that I was a bitch. Got better awful fast, didn't ya? Pick their arm up and drop it. If it somehow avoids their face then they are likely faking it. I'm not a doctor. It's just a trick I know. And if it hits their face, you yell, "Quit hitting yourself," and high five your friends. My mother, who is a doctor, likes to tell the story of when I was about 5 and was claiming I was sick. She asked me if my eyelashes hurt and I said yes. My father is a doctor and he had a patient who was addicted to painkillers, but also had legitimate need for them from his medical issues. He would write a prescription for 50 pills when the guy came for a checkup. One day the pharmacy called him asking if he had written a prescription for 150 pills. The guy had penciled in the one. My mom's a nurse and she said once some crazy lady came in and complained that she had the whooping cough, and whenever she coughed she followed it with a loud whoop. I'm an audiologist, and it's fairly common to have people fake a hearing loss. With adults, it's commonly for workers' compensation benefits. Children do it for attention or to get out of school for a day. They are fairly easy to spot. Patients will come in, conversing with me very normally, but the audiogram will show a profound hearing loss. We all have our tricks to get them to slip. I like to lower my mic volume to a normal range and mention that they dropped something when they're in the booth. They instinctively reach for it, forgetting that they shouldn't have heard it because of their loss. We can also do an auditory brainstem response, bypassing the need for patient responses. A Stenger test can identify those fakers that only have a hearing loss in one ear. My favorite is when testing kids that are clearly faking. Part of the test requires me to have them repeat words, so I present them at a normal volume and the kids are really straining to hear them. Then I slip in funny words like butt crack and watch to see them smile because they clearly heard it. Paramedic here. I have 3 stories that come to mind. Story number 1. We get called to a local Waffle House for a seizure. We walk in to find a man lying on the floor, not moving, but breathing. We start talking to the waitress, asking what had happened. While talking to her, we occasionally look down at the patient and find him with one eye barely cracked open, watching us. When he sees us looking at him, he closes his eye. This happens a few times. Then the cops show up and find out what's going on. One of the officers asks the waitress, "Did he, patient, eat here?" "Yes, he did." "How much is his bill?" $14. At this point, the officers roll the patient over and find his wallet. The guy has a $20 bill in it. One of the officers takes out the $20, gives it to the waitress, and tells her, "Keep the change." You could see the anger in the patient's face when he realizes he's not getting out of paying his bill. He ended up faking a seizure on the way to the hospital. I'm not about to explain how I know it was fake, because I'm not going to give anyone any info on how to fake a seizure. Story number 2. We get called to a fall in the women's bathroom at Walmart. We walk in, and the manager is freaking out. We go into the bathroom to find a white female face up on the floor. I'm guessing she weighs at least 350 pounds. There were two friends of hers standing in there with her. I ask her what happened. She says she slipped on a puddle and fell, hurting her back. I look all over the bathroom floor. There's no water on the floor. I ask the manager and the patient's friends, "Do you see water on the floor?" They all said, "No." I then tell the patient, "There's no water on the floor, ma'am." She says, "I'm lying on top of it." We're going to have to roll her to her side in order to get a backboard under her and pick her up. I explain that to her. As we roll her to her side, I check her back for any obvious injuries. I then check her clothing and the floor she was lying on. Nothing was wet. I have the manager, who was grinning from ear to ear at this point, and the patient's friends look. "Do you see water on the floor? Are her clothes wet?" They all said, "No." We then roll the patient onto the board, pick her up, and place her on a stretcher. At this point, I tell the patient, "I'm going to be writing up paperwork for this call and your treatment. Part of what is going to be written up is the fact that you said you slipped on a wet floor, and that no water was found either on the floor or soaked into your clothing. This is standard. I have to write up what I'm told in addition to what I see. What you need to understand is this: if you happen to decide to take Walmart to court, they can request a copy of my run report, and it's going to show what you said and what I found. They can also summon me to testify, and if they do, I'm going to tell them what you told me and what I saw, the manager saw, and what your friends saw. That being said, do you want to keep dragging this out and go to the hospital, or do you want to just get up from my stretcher and be done with it?" She chose to get up and leave. Story number 3. We get called to a 13-year-old having a first-time seizure. We get on scene, and the entire family is freaking out, except for the father. I walk into the room where the kid was. Obvious faker. I turn to dad and have him go outside into the hallway. I tell him the boy is faking, and I ask if anything unusual happened today. The father tells me he found marijuana in the kid's room, and he was getting on to him about it when the kid started seizing. I reassured the father that his son was not seizing, and he asked if we could take him to the hospital just to be safe. I said no problem. We pick the kid up and put him on the stretcher, and as we head outside to the ambulance, he exhibits more behavior that shows he's faking. Inside the ambulance, I tell the kid that I know he's faking and ask him to stop, but he keeps on. The hospital we take him to doesn't have board-certified emergency department physicians. They use general practice and internal medicine physicians. A lot of smaller hospitals do this. I bring the kid in and give a patient report to the internal medicine doc and the RN, and I say the kid is faking his seizure activity. The doctor had a problem with that. "You can't possibly tell that he's faking." I assure him that, yes, the kid is faking. I explain the situation that led up to him faking, and that I could prove it. The doctor says, "I'd like to see that." The RN knows exactly what's going on and what I wanted to do. He is all for it. So I say to the kid, "Bob, I don't remember his name. We need a urine sample from you, and we need you to wake up to do it. If you don't wake up, we're going to shove a tube into your penis, run it all the way into your bladder, and take a urine sample from you. Please, just wake up and give us a sample." Nothing from the kid. "Okay, Bob, if you don't wake up in 10 seconds, we're going to start prepping you to get the tube shoved into your penis." 10, 9, 8, 5, 4, 3, 2, 1. His eyes opened wide as saucers before he realized we caught him. He then closed his eyes, started blinking, looked around the room, and said, "What happened?" The RN was laughing, and the doc was a little pissed. Thanks for watching. Like and subscribe if you enjoyed. See you in the next video.